Hello, everyone, and welcome to the Happiness Journey with Dan podcast, where every journey is worth living. My name is Dr. Dan, and I'm your host for today's episode. I'm a bilingual cognitive behavior psychotherapist specializing in anger management issues, both court appointed and private, marriage counseling using the EFT method, dissociative disorders, narcissistic personality disorders, depression, anxiety, dream analysis, and also provide life, business, and retirement coaching support. I provide individual one-on-one sessions in both French or English, and also do group settings. If you need any assistance, reach out to DMV and coaching services at 301-325-1550, and our website can be found at lifecoachddanamzallag.com. Today, I'm very excited to have our third episode of season 11, a certified holistic health coach and fertility expert for women over 40, Donna Shaw. And just like every of my past episode, I will leave it up to the guests to properly introduce themselves, as no one can do a better job. Donna, the floor is yours.
Hi, I'm so excited to be here, and thank you so much for having me here. I wrote my book,
Mhm.
um, Poppin Past 40, the holistic path to midlife fertility, and I did it because I had a crazy fertility journey. So I've been a health coach since 2007.
Mhm.
And I loved being a health coach. I loved everything about it. I was focused on weight loss, and that took me to a very interesting place where I was working with people's weight. And then I noticed that using these holistic methods that their skin would clear up, any digestive disorders, their depression would clear up, get better. Um, just a myriad of different things would sort of correct themselves. And so it really sparked this excitement in me as not only a coach, but a healer. And I knew that there was a way to empower people to heal themselves, because it's that old adage from the Bible. If you give someone a fish, they'll eat for one day. If you teach someone to fish, they'll have food for a lifetime.
Right.
And so basically, when I work with someone, they have the tools in their toolkit to survive and deal with all these lifestyle problems and issues that come up, and they can sort of sidestep those things.
Mhm.
And that's really important for me to empower people. And then when I went through my own fertility journey, I met my husband at 41. I was a little bit of a late bloomer. Um, and when that happened, I honestly, I honestly thought that I would have no problem. I didn't even consider my age to be any sort of um,
Hinder.
a boundary or hinder. And then I had lunch with girlfriends who right off the bat they said, "Oh, so you're going to do IVF?" And I was like, I had not even thought about intervention because I am a holistic gal. And
Yes.
I've been on a modified fertility diet since I was 32 and in school at nutrition school. And so for me, I just thought, well, if I'm eating the best food on the planet, I'm going to be okay, because when our moms built our bodies, they built our bodies out of food. They ate the food, it became the tissue that became our bodies. And so I just thought, my eggs, my husband's sample, that it's all food, right? But I didn't realize there's so many other issues. And so, like anything, I feel like when you can go through something and then kind of look back and say, and present it and say, okay, here's what I went through, so you don't have to go through what I went through, then that's where great coaches happen, I feel. Like, I don't want to learn how to lose weight from an Instagram star who's like 20. Like, when I was 20, I had no issue. You know
Yes.
what I mean? So like, when, for me, having gone through this, I feel like now I can share it. And that's everything in the book is my journey, and then the tools I used, the exercises I've used, and my story. Because, as you know, as you're a therapist, right? You're
Yes.
a
Service. Mhm.
when you have an issue in one area of your life, it's not just that isolated situation.
No, unfortunately.
So I go very deeply into different issues that could create a sort of late start, delayed parenthood kind of thing, And we all have issues from our parents. Our parents were doing their best,
Yes,
you
yes.
know.
We know
So
no one comes with a manual, Donna. What our parents did, like you said, they did their best to be able to raise us with whatever tools they had. I mean, I was born in the 1970s, so the way that they did then, they don't do it now. So for me, I still take whatever my parents gave me as tools to be able to raise my own kids, but it's not really applicable in the same way. Now you have to adapt with what technology is, with how to be able to approach your kids. And what I feel that I have seen with parents being friends with their kids, sometimes I cannot really wrap my mind around that. I mean, there's something missing in this equation. So you see this happening, and then the parents wonder, why is my son using drugs? Why is my son this? Why my daughter that? I mean, the proof is in the pudding. I mean, come on. So you have to know the boundaries, and that's the thing. So when you help people, when I do it in my practice, and when you do it in your practice and all, you really have to do. It's a very customized treatment per se, because everyone deal with things differently. Everyone have their own past, their own traumatic experiences that you have to work with. So again, when it comes to fertility, I mean, some women, like if you look at some actresses, they got their baby when they were 44, or when you had, but they had very expensive treatment. Probably it didn't come naturally. So again, every cases are different from one to the other. So you have to really adapt to it.
exactly. And I think when you say they had this very expensive treatment, it's true. And I will add to that that a lot of these fertility clinics are really looking at you as a one size fits all situation.
Yes.
And that was a big part of my journey.
Mhm.
So I never wanted to go the intervention route. And when we had gotten pregnant pretty quickly after trying, and I had chemical pregnancies, miscarriages, I had a bunch of hiccups. And then finally, um, my friend said, "Oh no, you need to go to this guy, this top New York Magazine guy." And I think three of our friends had had babies from IVF with him.
Okay.
But when I went in, he was not kind or warm, and I get it. There are specialists out there that are not kind and warm but are amazing at what they do.
Yes.
And sometimes people just kind of, they're like, okay, bad bedside manner but
Yes.
good doctor, right? So sometimes we make excuses, whatever. And you could be having a huge intuition about, I don't like this place. I don't, because when I went in, I'm very warm and I like to talk. And especially, I like to talk with people that are going through what I'm going through.
Mhm.
So I would be at this clinic, this fancy Madison Avenue clinic, 7 in the morning. It was packed, maybe 100 people.
Oh, wow. Okay.
And no one was talking to each other. And the only warmth that I got were from these phlebotomists from Russia
Okay. Yes.
that were just
Taking
taking my
blood.
blood. And they were so warm. And I mean, they like my whole arms were like black and blue and whatever. And the doctor, I tried to have a conversation with him about egg quality. He looked me in the face. He said, "You can't change your egg quality, so don't even bother with it." Well, now we know there are all these Danish studies that are out. You can completely change your egg quality, and it takes only 4 months to change your egg quality. And for a man to change his semen sample, it takes 90 days.
Yes.
So we have so much power that, my daughter just turned 7. So 8, 9 years ago, when I was on my journey, it was totally disempowering. And then when I went through, they basically did a blanket standard thing that they do to everyone. And then they did little add ons because they say at your age, you have to do $2,000 for this genetic
Yes.
testing and another 2,000 for ICSI, which is, taking the exact sperm and not even giving it a chance to try and do its thing, which I was very against. But we paid the money, we did the thing. My body hated it.
Yes.
My body hated every minute of it. I hated the injections. Even looking at the medicine bothered me. So then we did it once. Everything was bad. I didn't even go to the second thing, which was the transfer. Then we did it again. I couldn't even get a retrieval because my eggs were so bad. And
Wow.
we used all this extra medication
Yes.
to stimulate everything.
Mm-hmm.
So that's why you're saying they have these expensive treatments. But then after I'd licked my wounds and gotten my head together and realized, hey, wait a second, I'm a powerful manifester. Because when I was 41 and single, everyone said you will never find a man who is single and your age who wants to be with you and quickly have children. And I said, delete, delete, delete. I'm not going to listen to that. And at the time, I was reading, I think I have it here. Have you seen this book?
Yes. Yes.
Oh, God, it's such a great book.
Yes, it is very intense. Absolutely.
So at that time, when I was looking for my husband, I was just like really focused. Where's the joy? Where are the people that are coming together? Where's the golden nugget? And so I changed the dialogue I was having with myself from doom and gloom, you're never going to meet anyone, to I only need one person. Okay, so maybe Manhattan is full of not the right guys, but there's got to be one guy for me, right? And then I said, thank you God for my husband. He's happy, healthy, and whole. He's available. He's healthy and vibrant and age appropriate
Mhm.
and super smart and financially independent. And I just kind of went through all these things.
Yeah.
He's kind. He's good to his mother. All this stuff, right?
Laws of
And
attraction.
so, what's that?
The laws of attraction.
The laws of attraction. So when I was going through all of the insanity, the fertility industry, and then I finally had a chance to get quiet, do a little meditation, get a little sleep, come back to who I am, regulate my weight because IVF 2 rounds, I gained 14 pounds out of nowhere. I did juice fast, I got myself together. Then I realized, okay, wait a second. I've manifested so many amazing things in my life. Um, I just need to apply these principles to manifesting the biggest, best thing that could ever happen to me, which is a baby girl. So, or son, whatever, you
Yeah.
know.
Yeah. As long as it's
Um,
healthy.
what's that?
As
As
long as
long as
it's
it's
healthy.
healthy,
Yeah.
right? So I met um, two very powerful doctors, Dr. Sammy David and Dr. Owen Davis.
Mhm.
And they both sort of told me whatever the treatment I received was kind of criminal because they had told me bold lies, you know, because they did a sonogram on my ovaries and said, "Oh my gosh, you have so many follicles for a woman your age," and they're telling you you're not going to be able to make an egg. There's got to be a good egg in there,
Yes.
right?
Absolutely.
And then he said, no, 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 you can change your egg quality. Here are some supplements I like. Then I went to Dr. Sammy David. He said, no, 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 let's do this. And then he did this. He said, we're going to check the most insidious reasons for people not being able to have fertility at your age
Mhm.
or at any age. And he checked my vaginal pH, which is a very simple test, like the easiest, like stupid simple, right? Like just like go home, have sex with your husband, come back, swab the lining of your vagina, put it on a slide, look in a microscope. If they're alive, you're doing great. If they're dead, your vagina is killing your husband's
Yeah.
sperm. So I was like, oh my God, that's hysterical. And all of a sudden it was like, dun, 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 your vagina is killing your husband's sperm. So I'm like, what do I do about it? He said, okay, we're going to do a baking soda douche. It's like 10 cents. So I did that. I got pregnant the next month, but it was a chemical pregnancy. So now I knew, okay, like one of the problems is fixed.
Okay.
Will never happen again because I will always do baking soda douche before trying to make a baby.
Okay.
Right? For me. Fine. Then he checked my immune system via a very simple test, about $600. He had to send it to, I think, Chicago or California, I'm not sure. But it was a
Is it when
killer cell.
Yeah, your body kills the egg.
Killer cell or elevated C19, which tells you you have a heightened immune system, and so all those chemical pregnancies could have been not viable eggs for sure, egg quality issue, but also heightened immune system. My body is killing those healthy embryos, right? Because I had about 5 chemical pregnancies. So then we started doing prednisone. I hated it. It wasn't for me, right? And then at the same time, a clairvoyant told me to get a puppy. Then when you get a dog, I know it was the weirdest thing, but think about it. Do you have pets?
I have a cat, yes.
Okay. So when you talk to your spouse, you're like, okay, did mommy feed you? You know, did daddy clean the litter box or whatever? And with a dog, it's even more so because you have to take the dog out. You can buy the dog clothing. The dog does teething,
Yes.
that loses the teeth, has stomach bugs. You have to,
It's like for a baby, yes.
It's like a baby.
Yeah.
So now I tell any women, if you're having an issue, get a dog, because right away you start relating to your spouse like a parent. You feel like a parent, and then you can take the baby out. And people are like, oh, look at the baby puppy, So then you're like, oh, and then you're snuggling and you have this whole experience, right? Okay, fine. So I got the dog. We're, moving right along. And then another thing, he said, okay, so when you did your IVF rounds, you went on antibiotic, which is classic. The doctors put the women on the antibiotic. Okay, fine. But they did not put my husband on the antibiotic. And when you are having sex, you pass bacteria back and forth.
Oh, okay. So you got sick.
So we were passing back the worst bacteria that is known for causing miscarriages, and that is ureaplasma. And I want to say it very clearly. I want your audience to know about ureaplasma, because in the book there are many stories of clients of mine who were on the fertility journey for a year and a half, and these doctors never checked them for ureaplasma. I worked with one woman who was 29 years old. Her uterus was riddled with ureaplasma, and they didn't find out until I said to her, go back, tell the doctor to check you for ureaplasma. The doctor had not checked, had worked with her for a year and a half.
Wow. Okay.
A $9 antibiotic took care of it, and a month later she was pregnant. So the reason I wrote the book is so that people understand when they go to a classic fertility doctor, they're not going to check your vaginal pH because they don't care. They're doing IVF.
Yes. The more expensive treatment.
Yeah. They're not going to check if you have these elevated cells because they want to get you hooked on these rounds. I have a friend, she did 21 rounds of IVF.
Oh my God. Is it like a $10,000 per round usually?
15.
15, okay.
So, and that was a really interesting situation also. I like to let people know, like, let's say someone is married to someone older or a guy that was very athletic. So when you go to a fertility clinic, they're not asking a man if he's had trauma to his scrotum. It's just not something the doctors ask.
Yes. Okay.
Like, how many times you hear someone got kicked in the balls? It's like, that could create a problem in that area. Okay. But nobody's going to talk about that. Right. Or, in this situation with this friend of mine who did 21 rounds, the husband was in his 60s. He had a varicocele, which is like varicose veins, but on your scrotum.
Oh, geez.
So that's a simple procedure. They go in, they take out because blood is hot, and the reason the scrotum is hanging outside the body is to be
Cool down.
cooler, because that semen needs to be cooler.
Right.
And when you get that varicocele, it's a thick, ropey vein wrapping around the scrotum, making it hot.
Heat, yeah, heat.
So those sperm are not going to be good. So I don't know. I just felt, uh, I felt that I should mention that in case your
Yes.
viewers have a situation like that.
Absolutely. And you do bring up a lot of very good point that, as you mentioned, the fertility clinic are all there about making money. And they will not give you the easy solution or the cheap solution. They're all going to try to dramatize it to say, oh my God, if you don't do the IVF, you are screwed. You're never going to be a mother. You never this. And again, you're right. They only focus primarily on the woman's issue, but they don't understand what can be also the cause of the man. They may have low sperm count. Instead of using tight undies, they should use boxer shorts. So a lot of different strategies, and even the food that they eat. You mentioned about the food and all that. So
Well, or where they keep their phone.
yes,
My husband always had his phone in his pocket. And when I realized what was going on, because again, this is hot. This
yes,
is hot. And there's radiation. Even
Mhm.
though I have a safe sleeve, I have but it's hot and radiation.
The
You don't
scrotum.
want it anywhere near your body. Women should not have it anywhere. I'm coaching a woman now in Oregon, because I do everything on Zoom, and we are getting her a garment that's like a big, like an apron type thing, that is radiation safe. So, because she's on the computer a lot.
Yes, okay. And do you think that now, when it comes to foods, Donna, I know you said you mentioned this in your book. So what would be the five top foods that women can eat to be able to increase the quality of their eggs?
That's a great question. So, when we think of fertility foods, I have a couple of superheroes that I studied with.
Okay.
One is oh my god, you know how you're on the spot and you forget someone's name.
Yeah.
Um,
Don't worry about the name. Just whatever.
so anyway, she's a nutrition superhero. I gotta. She's with the Weston Price Foundation. Give me a second. She's in the anyway, whatever. So if you go to Weston Price, you'll see. Oh, okay. So Sally Fallon is her name,
Okay.
and she's very into traditional foods. And there's this whole idea that because hormones live in the fat, we want to make sure there's enough fat on the body. Okay? So, for example, I've worked with women who are really into working out that want to be a size 0. And
Yes.
the first thing I say to them is like, what's more important? Being a size 0 or being a mom? And when you put it in perspective, they're like, okay, I've had women gain 15, 20 pounds because they need to make that fat. And as a matter of fact, in my interview with Dr. Gundry, the microbiome expert that's in the book, he also agreed with me that, you need a little more fat. So I would say when you're looking at stuff like that, and also Nina Plank, I love, she wrote a great book on fertility and fertility foods and babies' first foods. So that's a real good one. But I have I'd say a third of my book is dedicated to food.
Mhm.
So I would say really great pasture raised eggs. You're trying to create an egg. So anything with eggs is going to be good for creating an egg. Even like if you really love caviar,
Mhm.
which is never my thing, but people love caviar. So if you're the person that loves caviar, you kind of have to say caviar.
Yes.
Um, then have some caviar. I love sardines because you want a good omega-3 fatty acid.
Correct.
Um, you want foods that really flood the body with nutrients. So, like if you have a choice between string beans or roasted kale, I would pick the kale because it has like insane amounts of uh, it's just higher density of vitamins.
Mhm.
So you want to really flood the body with nutrients so that it has everything, you know. Um, so I would say you don't want to eat a ton of
Sugar,
restaurant
yeah.
food.
refined sugars and all
You
that.
don't want refined sugars. You don't want refined dairy. You don't want refined uh, grain. So, grain is kind of a no-no, but there are foods like yams are really great for fertility.
Okay.
Like I know when I worked with Dr. Wu, who was my acupuncturist who I loved, who's now retired, he was a big guy, with that.
Okay.
So anyway, foods, very important. Really good whole food, real food, food that is what it says it is. Avocados.
Yes. Yes.
And no cold salads.
Oh no. Okay.
No, you don't want cold. You don't want anything cold. No cold drinks, no cold salads, because you want to keep that area nice and warm.
Okay. So
Yeah,
it works for women, but for men, if they keep it warm, it's deadly.
exactly.
It's interesting the
It's a
analogy.
delicate balance.
Very delicate. So where can people find your book, Donna?
So, Poppin Past 40 Holistic Path to Midlife Fertility is on Amazon.
Okay. And do you have a
Um,
website?
all of my, say again.
Do you have a website?
I have a website. It's donnasonkinshaw.com.
Okay.
So it's all kind of one word.
Okay.
And or you can go to poppinpast40.com if you forget, but it's 40 spelled out. And I'm on all the socials. So please connect with me, Facebook, Instagram. I'm not that active on Twitter, but you know,
Not a
anyway.
problem. Well, Donna, that is all the time that we have for today's podcast. I really appreciate you taking the time out of your very busy schedule to join us. And thank you again for participating and inspiring our many listeners with your incredible story. Now, we hope that you've all enjoyed today's episode. I'm also very excited about the many upcoming guests that we have scheduled for season 11 of the Happiness Journey podcast, filled with inspirational stories just like the one that you listened to today. Now, here are some concluding words of wisdom. Sometimes struggles are exactly what we need in our lives. If we were to go through our life without any obstacles, we would be crippled. We will not be as strong as what we could have been. Learn to give every opportunity a chance. Leave no room for regrets. Be strong because things will get better. It may be stormy now, but it never rains forever. So when you hear the world say, give up, hope from within all whispers, try one more time. Know that most of the important things in the world have been accomplished by people who have kept on trying when there seemed to be no hope at all. Most importantly, the longer you wait for something in life, the more you'll appreciate it when you get it. Because anything worth living is definitely worth waiting for. By being persistent in our pursuit of our deepest destiny, we will continue to grow. There's no way we can choose the day or time when we'll be fully bloomed. It will always happen on its own. Only the power from above will have that valuable information. So keep on living, loving, hoping, and wishing that every day you are in this earth is because you have a purpose. My name is Dr. Dan Amzallag, and you may all keep pursuing your amazing journey in life.